Hello, everyone, and welcome to week 3 of the Mindful Healthcare Speaker Series, Resources for Challenging Times, brought to you by the Awake Network and mindful.org. My name is Dr. Rina Katecha. I'm a physician by background and founder of Mindful Medics, the Healthcare Starts with Self-Care program, which really looks to empower healthcare professionals to prioritize their own health and well-being, such that in turn, they're better able to look after the population at large. I'm delighted to be your lead host today. So over the course of this series, we've been hearing from eminent mindfulness and healthcare experts, leaders and teachers who are sharing their deep inner wisdom, their insights and practices to help us navigate these turbulent times. I've been told that we have over 16,000 healthcare providers from 60 countries across the globe signed up to this series. And of course, many of you are on this call. Wherever you are in the world, a very warm welcome to you. And I would love for you to chime into the chat section or the comments section, who you are, where you're from, your healthcare specialty, and just say hello so we can get an idea of the global healthcare community coming together in this space. Today, it's an absolute pleasure and an honor to have with us Dr. Kristin Neff. We're going to be in conversation with Dr. Neff, who, as many of you will know, is an associate professor of educational psychology at the University of Texas at Austin. Dr. Neff is a pioneer in the field of self-compassion research and really an authority in the field. She also has authored many books. My personal favorite is the Mindful Self-Compassion Workbook. I have worked through that book, and every time I do, I have various aha moments and insights which really help inform my personal practice. So I'm so excited to be with her today. And she's also really been very responsive to the need for self-compassion in the healthcare community by setting up and delivering and piloting self-compassion training for this particular group. And she's going to be talking about that today as well. Dr. Neff, a very warm welcome to you. Thank you so much for being here in this space and speaking to this community.
Oh, thank you, Rina. I'm very happy to be here. Really
Yeah, we're so excited to have you and to learn from you as well on this call today. Kristin, there's no denying these are unprecedented and challenging times for everyone, but perhaps none more so than healthcare professionals. Many are going through a whole range of human emotion whilst trying to safeguard the health and well-being of the population at large. I'm hearing from co-workers and colleagues who have gone through everything on a day-to-day basis, from fear and anxiety, guilt and grief, to moral distress and making key day-to-day decisions. And I was speaking to a colleague of mine just the other day, and she was saying, you know what, Rina, what the experience for me and what comes to mind is how unrelenting this emotional roller coaster has been. And it's the word unrelating that really stood out for me, because this is the case. As we now go into a phase where many countries are beginning to ease lockdown, there is this sense of impending fear. What might happen? Might we have a second wave, a second peak? And what does this mean for, again, the population at large, the health and well-being of ourselves, our colleagues, and our patients? And what I'm also now hearing of, now we've been in this situation for a few months, is a sense of COVID fatigue, for want of a better phrase. There's a real sense of mental, emotional, and physical exhaustion. Healthcare professionals have been sort of slamming their foot on the accelerator for months in sympathetic overdrive, as they've been sort of protecting or trying to protect the population. And so at this time, it feels relevant now more so than ever that we start to implement a self-compassion practice individually and across the system. And for a lot of people on this call, they'll be familiar with self-compassion, but others might not be. So I'd love to get your basic introduction to self-compassion, hear about the elements of self-compassion, and really your thoughts on why it's so necessary and how it might help us navigate these turbulent times.
Okay, yes. Well, in turbulent times, self-compassion is most necessary. So what is self-compassion? Well, it's basically just treating yourself with the same compassion, care, support, warmth, kindness that you would show to someone else, a loved one or a friend or just anyone you cared about. And so what is compassion? So if you break down the word, passion means to suffer, come means with. So basically, the state of compassion is the experience of suffering with, being connected to others in suffering. And the reason this is so important, especially self-compassion, is because in times like this, there's really no way out of the situation. There's no way we're going to snap our fingers and make COVID go away. There's no way we're going to get rid of the stress. There's no way we're going to, suddenly solve all the problems of an overloaded healthcare system. And so instead of getting out of the situation, self-compassion helps us get through a situation. It's actually a way of relating to our own struggles. So that we relate to our own struggles in a way that helps us get through. We're a friend to ourselves. We're supportive. We acknowledge how hard it is. We help ourselves in any small or maybe big ways that we can. But most importantly, we don't judge ourselves. We don't fall into the drama. We don't, we aren't like, just focusing on others. We acknowledge this is really hard. This is really difficult. This is really overwhelming. We acknowledge that it's not just us. This is, many, many people. We feel connected to others in our experience, which in some ways the pandemic helps because it's global. We of course, we recognize it's not just us, but we not only recognize that it's not just us, but we draw strength from the fact that we aren't alone, that we're connected to others in this experience. And then because it's so hard, we give ourselves kindness, support, and care. So it's really, and the research is pretty overwhelming on this point that when the going gets tough, whether it's you're dealing with the aftermath of combat trauma, there's a lot of studies on self-compassion with veterans, for instance, coming back from combat trauma, or with healthcare workers, facing trauma as first responders, the trauma of raising a special needs child or going through a divorce. When things are difficult and traumatic, having self-compassion with you as your ally as you go through the difficult experience will help you get through and survive. So, and I can go on and on. So do you want me to, you said you wanted me to mention the elements of self-compassion?
Yeah, please do that.
Yeah, so, the easy way to think about self-compassion is just treating yourself with the same support and care you might show to a friend. But when I wanted to research self-compassion over 20, and actually about 20 years ago, I knew I had to come up with an operational definition, a clear definition of what are the actual elements that need to be there to count as self-compassion. And then I measured it, and then we started doing research on it. So there are really three elements to self-compassion, and all three need to be there in order for it to be a stable mindset. The first is actually mindfulness, believe it or not. So it's not going to be a surprise to people here at the Awake Network, but you can't have self-compassion without mindfulness. So in other words, we need to be aware of the fact that we're struggling. And we need to be aware of our struggles in a balanced way. So we don't repress it. We don't like just do stiff upper lip and ignore it and just kind of, soldier through. But on the other hand, we don't get lost in it. We don't get lost in the drama. We don't like run away and ruminate about how, the storyline of how bad it is, which can also not help. So with mindfulness, we make some space around what's happening. We're aware of what's happening, and we relate to it in an accepting manner. Now, it doesn't mean that we don't want to change what's happening, but we realize that right now, this is happening. And so we need to accept it. So for instance, in the pandemic, again, we need to accept that it is happening. Hopefully a vaccine will come along or a treatment will come along and it'll get better, but that's in the future. Right now, this is what's happening. And so we need mindfulness to open to that without resistance so we can kind of make space for it. And then again, we need to remember our common humanity. So now typically when we get sick or, not the pandemic's a little different, but typically when we have suffering in some way, we get medical diagnosis for ourselves or a family member, or especially when we make a mistake or we're feeling like, oh, I did something wrong. In that moment, it feels like, I'm abnormal. This isn't supposed to be happening. It's as if everyone else in the world is leading a normal, perfect life, and it's just me who's screwed up, or just me who's going through this challenge. And that really makes things worse, because not only are we struggling, we feel all alone in our struggle. So because of the connected aspect of self-compassion, when we remember it's not poor me, woe is me, self-pity, which isn't actually helpful. When we remember, oh yeah, this is part of the human experience. And so, I mean, yes, in some ways it's easier to do this with the pandemic because it's global. And yet we still fall into the trap of thinking this shouldn't be happening, right? And yeah, it's a rare event, but throughout history, things like this do happen, right? Every 100 years or so, this is part of the human experience. We have these worldwide events where things become very, very stressful and difficult. And so by fighting against that and saying this shouldn't be happening, it doesn't really help. But so when we remember that, yes, it is happening, we aren't alone, this is part of being a human being, and we kind of need to band together and empower each other by recognizing our connection with others. That also gives us strength to get through. So the second element is a sense of common humanity. And then the third element is the kindness. And so if you look at the kindness of self-compassion and also compassion for others, it's really a motivation. So many scholars define compassion as the motivation to alleviate suffering. And the same thing with self-compassion. It's a desire to alleviate our suffering. And it's a little paradoxical because we need to accept the fact that we are struggling. At the same time, we're motivated to want to help. And so like in the moment, we need to accept that this is happening, but our eye is always on the prize, which is healing, growth, is change. Is there anything I can do to make the situation better, right? And so it's really, it's the warmth element and the kindness element that makes all the difference in terms of our ability to get through and also to heal from a stressful situation. Mindfulness is great, obviously. Mindfulness is wonderful. You need mindfulness. But if you're just spacious and accepting and you're kind of cold with it, it's actually not going to do you much good. We need to be warm and supportive, and basically what we're doing with the warmth is we're activating the attachment system. Okay, so mindfulness, it deactivates the sympathetic nervous system, the fight or flight response. By accepting it, we're fighting it, and we calm down, so it reduces sympathetic activation. The compassion, what's unique about compassion is it activates the tend and befriend response. This is the response that as humans, when we feel cared for, when we feel loved, when we feel connected, when we feel like we're parts of something bigger than ourselves, then that actually helps us calm down and helps activate the parasympathetic nervous system response. And so the warmth of self-compassion does that. So instead of just saying, wow, this is really hard right now, may I accept it? It's also adding in, and I'm so sorry it's so hard. Is there anything I can do to help, right? So that feeling of warmth and care actually is pivotal to giving us the strength we need to get through. All three elements are crucial.
Thank you so much, Kristin. And just as you're going through that, even though I am a firm believer in mindfulness and compassion, I still have a very entrenched and loud critical voice that sometimes comes up. It raises its head and it says, especially when you said about motivation to alleviate one's suffering. It was like motivation, you need motivation, you've got to crack the whip, you've got to get on with it, you've got to power through. We're in a pandemic, it's not, and I've heard you say this before, it's not hearts and flowers, but it comes across a little fluffy. So
it does, but so sometimes I like to talk about the yin and the yang of self-compassion. And so the yin of self-compassion is kind of the soft, tender side of self-compassion, very important. It allows us to be with ourselves as we are, kind of accept ourselves as a compassionate mess, accept our imperfection. It's kind of the tender healing power. It's almost like a mother or a parent who, we can hold ourselves in our brokenness, almost like we'd hold a crying child. and we help ourselves, the child part of ourselves especially, heal and calm down. But that's only one side. There's also the yang side of self-compassion. I'm borrowing from Chinese philosophy. The yang is more the active, I like to call it fierce self-compassion. It's like, instead of mom, it's mama bear, right? Sometimes we need that kind of mama bear fierceness, some tough love, right? So either we need that tough love to protect ourselves. Sometimes we need to say no to others or protect ourselves, no to discrimination, no to being overworked, no to injustice in our society, right? Or we need to say no to people who are demanding too much of our time, and we need to say no. You know, I can't do that. We need to draw our boundaries. That's an important part of self-compassion. Providing for ourselves, making sure we're meeting our own needs. You know, that's part of self-care that's talked about a lot for healthcare workers, but also motivation. If we care about ourselves and we don't want to suffer, we aren't just going to like be like, oh, okay, well, you know, I'm drinking too much and, you know, sitting and not going to work and, you know, oh, well, so I just ate 5 bags of Oreos. Ah, can I be kind to myself? That's not kind, right? Sometimes to be kind, we need to make a change. And so just like a parent, a compassionate parent doesn't indulge their child. A compassionate parent isn't just soft and like letting their child get away with anything, because if you care about your child, you're going to want them to be the best they can be. They need to go to school. They need to eat their vegetables. They need to exercise. You know, if you care, sometimes that love needs to be a little tough. But here's the thing, here's the difference. Motivation from self-criticism comes from fear. I better do it or else I'm going to beat myself up. That's, you know, if you're afraid of the whip, if you whip yourself, the idea is, okay, I'll do it because if I don't, it will hurt. I'll whip myself. And it kind of works. You know, a lot of people got through med school through harsh self-criticism. It does work. But it's like it gets you up the hill, but it's like this smoky coal-powered steam engine that spits out all this smoke. And it leads to things like performance anxiety. It makes you anxious. It makes you afraid of failure. It can lead to perfectionism. It can exhaust you. The motivation of self-compassion comes from love, from care, right? It comes from encouragement. I want to do well. I want to change because I don't want to suffer, because I want to support myself. Again, it's like a really good coach or a really good parent. They motivate their children or they motivate their clients, not because they hate them or they're inadequate, but just because they care about them. And so with self-compassion, we're just switching from this motivation of fear to a motivation of love. And that's kind of more the young, fierce, active side of self-compassion, which is equally important. We need both. One or the other is a problem. We need to be balanced and integrated.
Yeah, and I can actually see how, just as you're talking about that, my critical voice is sort of beginning to calm down and say, oh, okay, so it's not about me being, you know, soft and self-indulgent here. Actually, it's about seeing things clearly as they are, not better or worse than they are.
That's right.
Knowing that I'm part of a much bigger human experience here, and it's not just me. And then with that, offering love and kindness to myself as I navigate this difficulty.
Right. And giving yourself what you need. And so sometimes you need to pull back and relax a bit. Sometimes you need to go forward and work a little harder, right?
Yeah.
So it's really asking myself, what do I need in the moment? And wisdom tells you what you need. It's not necessarily soft or tough. It just depends on what's needed.
Thank you so much. And you know, I've been working a lot around employee health and well-being, and particularly with doctors and healthcare professionals who are struggling with their mental health or burning out, working on the front lines, or even working behind the scenes. And this was pre-COVID. Self-care was so necessary and so important. COVID seems to have accelerated the need. And self-compassion, of course, is part of self-care. And so what I would love to hear about is, given that you have been working with healthcare professionals or to deliver the self-compassion in healthcare communities program and training, what are your insights from that? Because healthcare professionals traditionally in our training, we're very well versed and we know how to give care and compassion to others, but
Mhm.
somehow we tend to have a personal blind spot when it comes to ourselves. And healthcare
Yeah.
professionals, particularly at this time, seem to have both internal and external challenges that they're contending with. So,
Yeah.
just based on your own experience, I'd love to hear some thoughts.
Yeah, well, so first a word about self-care. So the way self-care is usually understood, especially among healthcare professionals, is in terms of behaviors, self-care behaviors. So, eating right, exercising, taking time out for yourself, visiting friends, eating well, doing yoga, getting massages, spending time with friends. Self-care behaviors are wonderful, the more the better. But the problem is, as most healthcare workers know, do you have time for them, right? So when your time is really limited, actually practicing self-care can feel like one more thing to do on your to-do list. And so I actually see self-care as part of self-compassion, but self-compassion is not the same as self-care. Self-compassion means in the moment that you're struggling, right? In the moment that you are struggling, being kind and supportive to yourself. So for instance, the analogy is often used for self-care if you don't put your own oxygen mask on before helping others. But the problem with self-care is it actually doesn't happen when the plane is going down. It happens after you've crashed. I mean, if you're at the bedside of a patient and you're like overwhelmed, you're having to do a million things and they're struggling and you're like in that moment, you can't say, whoa, man, like this is freaking me out. I'm gonna go get a massage. See you later, You're right. It doesn't help in the moment.
Yeah.
Self-care is great and I love self-care, but it doesn't help you in the moment. So what self-compassion does is in the moment of struggle, which is, a lot of the day, any moment of struggle, how are you relating to that emotional pain, to that feeling of overwhelm, that stress? So with self-compassion, the way you relate to it is first with mindfulness, being aware of it. This is really hard for me. Feeling of connectedness. It's not just me. This is hard for everyone. And the reason this is important is the sense of self gets softer. You aren't so focused on yourself. It's like, this is part of something bigger than me. So you aren't so self-focused. And then giving yourself kindness to the fact that it's so hard for yourself in the moment. Right?
Mm.
And so the reason this is so important for healthcare workers, and I'm going to go into a little bit of detail about this because it's really important. There tends to be a feeling of, by the way, this is not just healthcare workers, it's any caregiver. So for instance, I'm a parent of a special needs child, and all parents are caregivers, or many people also care for their elderly parents, or so really for all caregivers. There's this sense that we need to focus our compassion and care outward because that's what we do, we're caregivers. And that somehow if we're compassionate to ourselves or if we care for ourselves, it kind of takes away from the resources we have to give to others. It's almost like this is zero-sum game. That's absolutely false, right? It's mutually supportive. The more you give to yourself, the more you have to give to others. And there's two ways that it works. One of the ways is just because you have more emotional resources. When you shame yourself and you criticize yourself, you deplete your resources. And partly that's through sympathetic nervous system activation, and it leads to like hypertension and stress, and you just have a lot going on. You actually don't have the emotional resources to give to others because you're helping to drain yourself. Not only is the situation draining, but you're making it worse through harsh self-criticism. But there's another way that it works. So one of the reasons it's so difficult to be a caregiver is because of empathic resonance, right? So we know the brain is actually designed by evolution to feel the emotions of others. Some people argue that we have specialized mirror neurons. There's some debate, but we do know that the brain, we have entire networks whose whole function it is evolutionarily to feel the emotions of others. And that was very good for survival. So when you are working with a patient or a child or anyone who's sick or in pain or struggling in some way, the pain centers of your brain are being activated in the same place as the other person's pain centers are being activated. That's partly why you're a good caregiver, because you're sensitive, you're empathic, you feel what other people are going through. That helps you, tailor your care to be more accurate. But the problem is day after day, when you're resonating with others' pain, it starts to burn you out, okay? And so when we give ourselves compassion for our empathic pain, so we also give compassion to others. But when we also give compassion for ourselves, this is so hard for me right now. I'm feeling overwhelmed. I'm feeling, I'm feeling confused. I don't know what to do. I'm feeling so tired. When we give ourselves empathic pain, it helps us and gives us more resources. But here's the cool thing. It also helps the other person because they have mirror neurons too. Okay, so think about it. When you interact with patients and you're burnt out and you're frustrated, oh, and by the way, this operates not at the level of language, it's pre-verbal. Our brains just pick up on vibes. We really do pick up on vibes. And the reason it's pre-verbal is because parents and infants, they need to have a way to communicate before language sets in. So basically parents and infants communicate through empathic resonance. The baby feels the parents' love and care and support, the parents feel the baby. So we've got this empathic resonance going on. It's a two-way system. You're being impacted by the people you care for, but they are being impacted by you. And so yes, I'm sure you're a professional and you're trying to, you wouldn't say like, oh my God, I'm so stressed out. You're going to try to hide it. But people can pick up to a large degree on what your mind state is, even if you aren't verbalizing it. So if you're stressed or you're full of shame or criticism or you're kind of shut down, patients can feel it. But if you are full of self-compassion, if you're full of, one way to talk about self-compassion, the three components is loving, connected presence. Love is the kindness, connection, and presence and mindfulness. When you're full of loving, connected presence, even if what you're being connected with is your own pain, if your mind state is calmer, it's more peaceful, it's more kind, it's more connected, other people pick up on that. And so it can actually help calm them down. So for instance, I said my son is autistic, right? And autistic people, they have trouble mind reading, but they're actually very sensitive empathically. That's partly why they close themselves off, because they're so resonant with other people. They've got to like shut themselves down. But my son was very sensitive to me when he was growing up. And I remember he used to have these, horrible ear-splitting tantrums in public usually. And if I was hard on myself, oh, Kristin, why can't you be a better mother? Or, if I just let myself kind of get lost in the freaking out about it, his tantrum would get more intense. In other words, he would tantrum, I would get upset, he would get more upset. But when I could learn to soothe and comfort and care for myself, I'd say something like, Kristin, this is so hard. Self-touch is a very good way to soothe and care for yourself. So I say, this is so hard. I feel so hopeless. I don't know what to do. It's okay. I'm here for myself. We'll get through it. When I could calm myself down, he would calm down. Right? So it goes both ways. There's also research that shows self-compassion is contagious, right? So in other words, when we're compassionate around other people, they pick up on it and they're more self-compassionate as well. So this whole idea that we're separate people and I'm either compassionate to you or incompassionate to myself is a complete fallacy. We are interconnected. How we relate to ourselves impacts other people, just as how we relate to other people impacts ourselves. So really, I think for caregivers, once people realize that, it's kind of like, oh yeah. And so it's actually an act of grace, and it's an act of compassion for others to have compassion for yourself, because you will help others by being more self-compassionate. And you'll be less likely to burn out. So bonus.
Kristin, thank you so much. I mean, you've said in a very short space of time, you've highlighted so much and, done some myth busting as well for us in this as well. And of course, now I'm super sort of anticipating and super excited to do a practice, if we may, given that, of course, the theory is nice, but for a lot of us, until we start to experience some of that loving, connected presence, we're not really having the true experience.
Yeah. So, okay. So I'm going to teach a practice from, so I think you mentioned briefly, let me just explain it a little bit. So we've developed a self-compassion training, particularly for healthcare workers. It's called Self-Compassion for Healthcare Communities. You can take it online through the Center for Mindful Self-Compassion. And so basically it's designed so that healthcare workers don't have to sit down and meditate every morning. They don't have to do any practice off the job. it's all techniques you can use on the job, you know, because you don't have time usually off the job to do this stuff. And so they're practices that can be done in the moment. So practices like, you know, using touch to calm yourself, your sympathetic nervous system can be very effective. Speaking to yourself with kindness. But we teach a particular practice called compassion with equanimity, which I'm going to teach in just a moment, which is designed to be used when you're with patients, when you're with someone that you're caring for, or it could also be your child or your elderly parent. Okay, so it's basically designed to be used in the moment when you are empathically resonating with someone in pain, and therefore you are feeling their pain. You're also feeling the stress and the overwhelm and the tiredness of having to care for people. And so it uses compassion for self and compassion for others. Both are necessary, but also equanimity. So what is equanimity? It's a concept that actually is talked a lot about among mindfulness meditators. Equanimity is the realization that we aren't in control, right? Understanding that even though we would like to be able to help people and fix them and heal them, we would like things to go the way we would like them to go. It's just not possible, right? We are limited human beings. We only have very limited control. We can try our best, but you know, everyone's kind of on their own journey. We can't control the outcomes for other people. And so it's really important for healthcare workers, especially doctors. People treat them like they're supposed to be God. You know, they expect you to get everything right and to fix everything. They may expect that, but it's just not reality, right? So we need to remember with equanimity that we try our best and we don't have control, combined with compassion for ourselves and others. And these two together make a really potent combination. And we find that the people that we trained at Children's Hospital say it actually saves their lives, really, literally. So it saves their lives in terms of being able to cope with the stress. Okay,
Wow.
so this is the practice. Okay, so I'm going to teach it. I'm going to do it for about 10 minutes. And so I'm going to teach it like a meditation, just because, you know, we aren't at the bedside of a patient right now. We are here in this artificial context, but remember, it's designed to be used on the job when you're with patients. Okay, please go ahead and close your eyes. Okay, so close your eyes and settle into your body. Maybe take a few deep breaths. It's just a lot of talking, so take a few deep inhalations and exhalations to help yourself calm and relax. Okay, so letting your breathing return to normal. And I'd like you to imagine that you're with a patient right now. Okay, and try to make it a real patient, so you can make it real, a patient maybe that you've worked with recently, and you found the interaction very difficult, right? So it's very stressful. That may be because you were so overworked or tired, or maybe the patient was, you know, really having a hard time physically, emotionally. Right, so imagining that you are with this patient, trying to make it as real and vivid as possible. Trying to get in touch with some of the feelings of overwhelm or exhaustion, empathic pain, how hard it is to do this job. And so I'm going to say some words of equanimity, and I'd like you to just let them drop into your awareness. Everyone is on their own life journey. I am not the cause of this person's suffering, nor is it completely within my power to make it go away, even though I wish I could. Moments like these are difficult to bear, and yet I will try to help if I can. Okay, so letting those words kind of percolate, settle in. Now I'd like you to switch your attention to your breathing, particularly your in-breath. So you don't have to breathe particularly slow or anything, but just notice you're breathing in Right, so you're naturally breathing in, you're breathing in oxygen to nourish your body. But I'd also like you to imagine, you use the breath as a metaphorical vehicle for breathing in compassion to yourself. Right, so imagine that as you breathe in, you're breathing in kindness, care, and warmth, validating how hard it is for you as a caregiver. If you want to support this, you may try putting a hand on your heart, for instance, or one on your stomach. Give yourself that physical sense of support. If you want, you can also enhance this by imagining that you're breathing in like a golden healing light for yourself, filling your body. But breathing in for yourself, or acknowledging how hard it is for you, breathing in compassion for yourself. And now I'd invite you to switch your focus to the patient that you're caring for, in your mind's eye at least, right? Imagining this patient, you can remember what they look like. And imagining that as you're with your patient, you're breathing out for the patient. You're breathing out what they need, right? Compassion for their struggle. So now focusing on each out breath, and as you breathe out, sending compassion to this patient. And again, if you want, you can imagine you're sending them a golden healing light that's filling their body. Validating how hard it is for the patient. And then bringing both together. So on the in-breath, you breathe in for yourself, and the out-breath, you breathe out for the patient. So in for me, and out for you. Right, so if you're imagining the healing light, maybe it just kind of encompasses both you and the patient. Remember, you're validating and caring for your own struggle. And you breathe in, validating and caring for the patient's struggle as you breathe out. So one for me and one for you. And feel free to adjust the ratio. So if you're really feeling your own struggle, feel free to focus mainly on your in-breath. Maybe it's 4 for me and 1 for you. Or you can also focus more on the struggle of the patient and focus more on the out-breath. Right? So let the breath and the compassion flow to where the pain is, whatever's salient for you in the moment. But always including self and the other. Letting the compassion rise and fall, just like the waves of an ocean of compassion. Source of compassion is unlimited, more than enough for me and more than enough for you. And then once more, letting these words of equanimity just drop into your awareness. Everyone is on their own life journey. I am not the cause of this person's suffering, nor is it completely within my power to make it go away, even though I wish I could. Moments like these are difficult to bear, and yet I will try to help if I can. Okay, and so letting the practice go, and then opening your eyes. Right. So yeah, so that gives you a sense of it. But again, the idea is the equanimity is kind of a mindset that you need to remind yourself on. We have a lot of nurses and doctors like tape those words, various parts of in the workstation, to remind themselves, okay, I can't control, I'll try my best. And then the breathing, anytime you notice you're feeling overwhelmed or confused or burnt out, breathe in, give yourself full permission to breathe out, breathe in for yourself. But then also remembering to give compassion to the other as well. And a lot of the doctors and nurses tell us that it's a really helpful practice on the job. It doesn't take any extra time out like we did there.
Thank you so much. And Kristin, I have some thoughts as based on my own experience of that practice, which I'd like to share with you in just a moment. But
Okay.
before I do that, I want to highlight to the audience that for those of you who are joining us live on Zoom, we're going to be opening up to a live Q&A with Dr. Neff. So if you are open to asking a question, if you're wanting to ask a question, I would invite you to chime in your question in the Q&A section at the bottom of your screen. Please make sure that you are happy to come online with your audio and video switched on, that you're going to be with us for the rest of the call. And if so, then type in the word live, L-I-V-E, your name, who you are, where you're from, your medical specialty, and then of course, finally your question. And listen out for me to call out your name in a few moments. And if we do that, you'll be on with Dr. Neff live and you'll be able to ask her your question. Okay, so just giving you some time to do that. Kristin, when you started and said, bring to mind a patient that you've had some difficulty with, almost immediately I could feel like there was this sense of closing off inside of me, and I was beginning to actually feel quite tense. And that tension was coming from a sense of, I wish I could do more for this person. And it's so amazing how, as we transition through that practice, I just felt a sense of opening in my body. And that was really, a real somatic experience for me, which actually I haven't really experienced before. Usually I would get it on a sort of cognitive level, but my body started to respond to that. And I'd love for you to share some thoughts around the somatic experience.
Yeah, well, so self-compassion, we know from the research, does change your physiology. What it does is it reduces sympathetic nervous activity. It reduces, for instance, cortisol. It also increases parasympathetic activity, increasing things like heart rate variability. And so what we're doing, like quite literally, when we give ourselves compassion, is we're deactivating sympathetic response, we're activating parasympathetic response. And that's why, for instance, there's research showing that self-compassion is linked to better physical health, longer telomere length, which predicts lifespan, things like that, because of that it works beneficially on our nervous system reactions to stress. So
Perfect.
you can feel it. And then, by the way, that's also why we do things like touching yourself. And yes, it is touchy-feely, but there's a scientific reason for that, right? Because again, as infants, we respond to touch well before language sets in. So the body's exquisitely designed to respond to touch as a signal of care. So if you put your hands on your heart or, some sort of place on your body in a caring way, the body responds physiologically. Yeah.
And I'd love for you to share perhaps some techniques around touch, because I've had a few questions come up, like, in the moment on the ward, like, am I
Yes,
meant
yes.
to put my hand on my heart,
Right,
or,
yeah.
give myself a hug? How does that work?
Yes, yeah. So you have to have a variety of touches. So you don't put your hand on your heart on the ward. But when you go to the bathroom, you could, right?
Sure.
But so it's really interesting. So we've been teaching this healthcare program. It was at Dell Children's Medical Hospital. We've taught a lot of programs now, and it's great because there's a culture of it now. It's part of the culture that everyone tries to encourage self-compassion. So if your colleagues like have taken the course with you, you can you can do it and you won't be judged for it. So, and there's kind of people will help each other remember to use compassionate touch. But if you're in front of a patient or something, just you can hold your hand, or you can, like, if you fold your arms, like, actually just try it, Rena. Fold your arms like in just kind of whatever, in a whatever way, but now fold your arms, and as you fold your arms, imagine that you're supporting yourself. You're kind of like, oh wow, this is really overwhelming. Oh, I'm here for myself. It's going to be okay, right? So if you add like some internal dialogue with the touch, something like folding your arms, people can't tell, or you can kind of hold your hands or put your hands in your lap. So really, it's the intention behind the touch. It's not so much what type of touch you use. It's that the intention behind the touch is a caring one, and you can fit that in a lot of surreptitious ways.
Do you know, Kristin, it's amazing, because as you were inviting me to do that, I had a sense of my grandma, like my sort of wise, compassionate grandma who passed many years ago. But I remember how she would hold me, and I would get a lot of sort of comfort and soothing from that. So thank you for that personally, for making that come back alive for me. Kristin, I have a question. So I was wondering if you would be happy to open up to a live Q&A.
Absolutely.
Perfect. So we've first got Retta Graham. Retta is an MD in obs and gynae, and she is going to be coming online. And I see Retta is ready to be online. So Retta, welcome, and we'll get your audio and video switched on. So you should see a pop-up. Just click yes, and there you are. Welcome, Retta. Oh, we can't hear you so well.
Sorry, I didn't expect to be called on so quickly. Let me put my earbuds away.
No worries.
Okay. So I work in an obstetrics emergency department, and I've been doing OBGYN for about 17 years now. And in the midst of this career path, obviously, all outcomes are not perfect. So I feel that I've in the past experienced some fairly significant trauma with the loss of babies or mothers even. And sometimes that gets triggered in the midst of stressful situations on the labor and delivery unit. And so I'm just wondering if you have specific advice for those of us who have been doing this for some time and have some built up old trauma.
Yeah. So yeah, thank you so much for the question. So one of the things we found in our research on this program is it does help reduce secondary traumatic stress, right? Which is when we get post-traumatic stress from dealing with so much trauma. So now here's the thing, sometimes when you're in the midst of a real traumatic situation, or when you're having flashbacks about it, sometimes you actually don't want to practice too much the self-compassion, because there's a phenomenon we call that occurs called backdraft, which is like the way most of us have dealt with our trauma is by closing our hearts, right? And sometimes when we start to open our hearts, you know, it's like the fresh air of the love rushes in and the trauma rushes out. It's actually a good sign. It means you're doing it right, not that you're doing it wrong, but it means you want to go more slowly because it can be overwhelming. You can start to dissociate. You can start to have a panic attack. So really what you want to do when that happens is you actually want to go to two things, either some sort of grounding mindfulness practice. So one of the practices we teach is you just simply feel the soles of your feet on the floor. You literally ground yourself to the earth, right? So you put all your awareness into your feet. This is actually, by the way, there's research showing that this is effective. It helps reduce amygdala reactivity. I think partly it's because like your attention is as far away from your brain as possible. So you ground your awareness in your feet. You can do this anywhere, anytime, and you really just focus for a few moments on that feeling of connection of your feet to the floor. That's one way you can ground yourself. The other things you can do are actually behavioral ways to practice self-care. Right. And so now here's self-care again. And it's not so much, I mean, yes, self-care is good to be rested and resourced and stuff. But let's say you're experiencing a traumatic flashback or you're having some, you know, episode. If you go have a cup of tea, but do it with the intention of caring for yourself, what you're actually doing is you're training your brain to ask this question, what do I need? And then you're giving it to yourself. So actually, sometimes the best thing to do in that situation isn't to practice self-compassion in terms of putting your hand on your heart or saying something kind to yourself. Maybe what you need to do is just stabilize. So have a cup of tea, take a walk, you know, do something else. But here's the thing, often we do it unconsciously. We distract ourselves by behavior. And when we do it unconsciously, it actually doesn't help us because we aren't building the muscle of caring for ourselves. So if you just do it intentionally, what do I need right now? I need to go have a cup of tea because I'm really overwhelmed. And you do that with intention, you're actually building the habit of self-compassion. Does that make sense? Yeah, okay.
Perfect. Thank you so much, Retta. And I think actually Retta's brought up a really important point around trauma and
Yes.
what we might be seeing in the aftermath of this situation.
Yes.
And so with the sort of backdraft,
Yes.
so to speak, Kristin, I'd just love to hear a little bit more about that. Is that something, if we know that we might be prone to experiencing trauma,
Yes.
can we somehow limit backdraft?
Yeah, so, you know, first of all, again, remember that backdraft is a good thing, believe it or not. It doesn't feel like a good thing. So what you don't want to happen is to say, I'm experiencing backdraft, oh, it's one more thing I'm failing at, and then just give up the practice of self-compassion. It's part of the healing process. You know, the only way out is through. But what you do want to do is kind of ramp it down. We teach something called conscious opening and closing. When you're feeling pretty safe, you can kind of challenge yourself. You can, you know, let maybe more difficult emotions in. You can open to them more with mindfulness. So mindfulness can be used to open to what's happening in the moment, but it can also be used to close from what's happening in the moment and to focus on something else. So you aren't doing it in a mindless way, in a reactive way. You aren't just shutting yourself down. You're using your mindfulness to say, this is overwhelming. I'm going to focus on something else. I'm going to, let's say, focus on the soles of my feet, or I'm going to have a cup of tea, or I'm going to do something else. But when you do it with awareness, what you're doing is you're actually helping yourself from being overwhelmed from the backdraft. And again, you're still building the habit of giving yourself what you need in the moment. And so, yeah, I mean, the secondary traumatic stress, and not even just secondary, I mean, primary trauma that people, you know, catching COVID yourself, giving it to your family members. I mean, it's going to be intense, right? And so we aren't going to be able to just snap our fingers and make it go away. The only way through it is going to be to try to resource ourselves and others as much as possible with support, with kindness, with encouragement, with warmth, with a lot of acceptance. You know, sometimes we like to say that the goal of practice is simply to become a compassionate mess. Right? The goal of practice is not to be perfect. The goal of practice is not to get rid of all our problems, or to get rid of all our trauma. I mean, if it were possible, okay, but good luck with that one, right? That's not the human experience. So, but if your goal is just simply to be compassionate with our trauma, to be compassionate with the mess, to be compassionate with the pain, that is achievable. And what that will do, the compassion will give you the strength to get through it. Again, it's not a magic wand. It won't make the pain go away, but it will help you hold the pain with love.
Yes.
And so, I remember with my son, again, I told you, by the way, my son is doing so great now. He's 18. I have no complaints. But,
That's so great to
but
hear.
when he, when in those really difficult moments when he was young, I would actually learn to just flood myself with love for how hard it was to go through some of these traumatic experiences. And what you can learn to do is you can actually learn to almost like identify or feed off the love that's holding the pain. The pain is still going to be there, but the sense of loving, connected presence that holds the pain is what allows you to get through.
Yeah, thank you so much. And no doubt it will allow all of us to get through this difficult time, for sure. One more question, Kristin. We've got Tina coming up, Tina Runyon. So Tina's going to be coming up on our screen in just a moment. And Tina is a psychologist. So Tina, welcome. Can you hear us? Yep, we see you there. Welcome. Oh, no, we can't hear you.
How about now?
Yes, we can
Great.
now. Perfect.
Oh, lovely. Thank you. Thank you for taking my question. Thank you, Rena. Thank you, Kristin, for this offering. So very deep bow of gratitude to both of you for this. I'm a clinical health psychologist, and my clinical practice is actually exclusively with physicians. And I talk a lot about self-compassion, and I appreciate the question and the framing about trauma as well, because a lot of health professionals, whether it's talked about or not, have a prior history of trauma, and sometimes that's their impetus for coming into this field. Right. And I've seen a lot of that get re-triggered through COVID. So I talk a lot about self-compassion. I'm a big fan of your work. And but I hit a lot of walls in leadership and in the culture of medicine and in institutions, because I think there's a lot of talk about clinical empathy, and there's more and more acceptance of this idea of empathy. I try to educate around this tension between empathy and compassion, but I'm wondering if you have any language for those of us kind of working within institutions to try to elevate this concept, some of the risks of empathy and the benefits of compassion, and language that feels more accessible, perhaps in more sterile or traditional hierarchy medical cultures where this idea of self-compassion it is not embraced. And I mean that really culturally and organizationally, and how to have leaders model self-compassion, because I agree it is different than self-care, and we get a lot of platitudes around self-care, but I don't see a lot of modeling of self-compassion, and including baking time into the day, that it's something that happens afterwards. And I don't know if you have any words of wisdom that can help elevate, from a cultural standpoint, about how to do this.
Yeah. So when we created the self-compassion for healthcare communities training, we branched straight into that. So the language is really, first of all, we use a lot of science. Luckily, this isn't just a good idea. There's a lot of research around it. And so we find that with healthcare professionals, especially doctors, the more you lead with the science, especially the fMRI studies, but any sort of research. And if you go to my website, selfcompassion.org, I've got, hundreds and hundreds of studies on there. That tends to help. You need to realize that there are 5 common myths. Research disproves all of them. That it's selfish, right? It leads to better relationships. That it's self-indulgent. It actually leads to healthier behaviors. People exercise, they eat right. People think the biggest one, it'll undermine their motivation. It actually increases motivation. People are afraid it's going to let them off the hook. It increases personal responsibility. And another big one, people think it makes them weak, and it actually makes you stronger. And so sometimes with some people, we don't even use the word self-compassion. We just call it inner strength training. right? Self-compassion is a strength. I mean, so for instance, they're teaching self-compassion in the VA with veterans and with a lot of kind of military culture. And so the metaphor that's used is when you go into battle, what voice do you want in your head? Do you want an enemy voice saying you're crap, I hate you, you know, you should do better, cutting yourself down? Is that going to make you stronger? Or do you want an ally? Do you want the voice to say, hey, I got your back, I'm with you, you know, I'm going to support you, I'm here for you? That type of supportive voice obviously is going to make you stronger, right? Or think of sporting analogies, war analogies, all these analogies can be used and they're all true, but it expresses the idea in a way that's a little more yang, actually, a little more this kind of, you know, masculine gender role identity kind of plays into it as well, but it's not just gender, it's kind of the medical culture as well. So science-based and using terms that focus more on support. And you don't even have to use the word compassion. If it's going to trigger someone to use the word self-compassion, don't use it. Call it inner strength training, you know, same thing.
Thanks.
Thank you so much for that question, Tina. And it's so apt at this time, particularly given what's happening in the world, that we do need more self-compassion, and it's not selfish and it's not self-indulgent. In fact, it's a strength. So thank you, both of you, for highlighting that. Dr. Neff, we have had, honestly, this has been probably one of the most enlightening hours of my life. And we've had an amazing conversation. And before we wrap up, I would just like to take some of your final words, really. Is there anything you'd like to share with the audience?
Yeah, well, just basically that I really hope the people that are listening will at least try it out. I mean, just try out for 1 week, being kinder or more compassionate to yourself. And that might be just stopping and asking, would I say this to a friend I cared about? You know, no. and just try being more warm, kind, and supportive with yourself, and observe for yourself the difference it makes. You don't have to take my word for it. So self-compassion really does change lives. And so I hope that you give it a shot, because it can really make a dramatic difference in your ability to cope with everything that's going on right now.
Thank you. Thank you so much for that. And of course, if all of you would like to learn more about Dr. Neff's work, you can take a look at her website, and also take a look at the Self-Compassion for Healthcare Communities program as well that Dr. Neff are you currently researching? Is that correct?
Well, we just got to revise and submit. We conducted research on it, and it came out really well. It reduced burnout, reduced secondary traumatic stress, reduced stress, reduced depression, increased compassion for self and others, and mindfulness. Outcomes are really good. So we're just publishing that now. Oh, and Brilliant. By the way, if any of you enjoyed that practice I taught, I've got a video of it. It's on my website and also the Center for Mindful Self-Compassion website. So Brilliant. If you go to just Google self-compassion, go to practices, and you'll find it.
Thank you so much. And what we'll do through the Awake Network is we will share links to all of this on your bio as well, so people have easy reference to that. And with that, my friends, I would just like to share that I'm so grateful that you're with us in this global community, and we're here together. The sense of common humanity is truly present. And thank you for showing up week in, week out. We're, of course, going through a whole series, and our next session is next Tuesday on the 9th of June at 1 p.m. EDT with Frank Ostaseski. And Frank is going to be talking about how we can hold our grief and really the healing potential of love when we're able to compassionately turn toward all of our experience. Difficulty, death, challenges, everything is included. And Frank has a real gift for illuminating the raw heart of the matters that we're dealing with currently. He's an internationally respected Buddhist teacher and a visionary, one of the co-founders of the Zen Hospice project where he served for many years and cared for hundreds of patients through the AIDS epidemic. So please do join us for that. And please do share this resource. It's a free resource. These incredible teachers are sharing their time, sharing their expertise, and sharing practices really as an act of service. And so with that, I would just like to say thank you for coming. Please do share more widely. And if you're not able to make the session live, of course, the recording will be available to all of you. Thank you again, all of you, wherever you are in the world, for the work that you do and for serving humanity.
Yes,
at this
thank you.
time.
I wanted to add that. Thank you so much. The sacrifices of the healthcare workers have just been mind-blowing. So I'm so appreciative. That's why I'm here.
Thank you.
Yeah.
Thank you so much, Kristin. And with that, be well, my friends, and we'll see you soon. Take care.